afternoon, lecturer of the Faculty of Health Sciences. So today my talk is about the low back pain. So this low back pain is the pain that felt by the people over the lumbar region when you talk about the anatomical structure. So the lumbar region is the back, which is at the lowermost region of the spine. So whereby if the people are felt by the pain, this we categorize as the low back pain. So this low back pain worldwide responded to the fifth reason for the physician visits. So approximately every year, 60 to 80% of the people will be having a low back pain as in their daily living activities. So talking about how to categorize this low back pain from the other back pain. So this back pain is basically categorized into two, upper back pain and the lower back pain. If the pain that arises from the lumbar region, that is your back, we call as the low back pain. If some pain that arises from the upper region of the back, we call as the upper back pain. Right. So talking about how the people will felt about this low back pain. So people who are suffering from this low back pain, so they will be severely affected physically and mentally. And these people, they felt that the pain will take over their life. So that kind of severity of the pain will be felt by the patient who is hurting their back. And talking about what type of pain and what is the pattern of pain they will be felt is, some people they will feel the pain is sharp in nature. Some people will feel the pain is radiating to the other part of the body. Some people will felt that it will be a nagging and it is a dull aching. So what type of pain and how it is because of which structure of the lower back is getting affected. So when you want to talk about the structures that in the lower back, so basically about the spine. Right? So the spine holds the stability of our back, and this spine is formed by the integral segments of 24 small vertebral bones. So each bone, the two bones are connected by the intervertebral disc. Then it is supported by the muscles, ligaments, and this vertebral column is the area where it gives space for the spinal cord, and thereby the peripheral nerves comes outside from the spinal cord. So which structure of this area is affected, accordingly the pain will be felt. And how these structures will be getting hurted, it is because of the overloading. The way how we sit straight, or the way how we moving our body during the time of our activities. So accordingly, each patient will be getting the nature of the pain, because each structure will produce the different pattern of the pain. So coming to the reason for this particular pain is mainly the poor posture. So talking about the poor posture, the way how we sit, right? So using of the gadgets is an example. So most of the time we will be using the gadgets, so without knowing that we are in a good posture or in a bad posture. It's all about the alignment of our spine, right? So the spine itself is having the natural alignment. So when we were moving away from the original alignment of the spine, the structures that forms the vertebral column will be overloaded. So in the form when we stretch to the extreme, or when we were taking some load, or when we are using the abnormal posture, these individual structures will be loaded accordingly. When it crosses the threshold limitation, it will get harder and the pain will be originated accordingly. So this is one of the main reasons for the low back pain. So other than that, people who are over obese. So here also the loading will be happening inappropriately. This is the reason. Then other than that, we'll be having the muscle weakness, because the two major muscle groups that holds our erect body posture is the abdominal muscle and our back muscle. So when these muscles are in the weakened state, the stability of our spine will be lost, and this is one of the reasons for the abnormal loading, and that causes the low back pain. So now coming to the question, right? So should I need to visit a hospital for curing my low back pain? It depends upon how much your pain level is improving. So if your pain level is keep on getting aggravated for 2-3 days, of course you should go and visit a healthcare provider. So they will decide upon what type of treatment you want to take. So coming to the treatment part is, Of course, some treatments are home-based treatments. Some treatments are not so worth what you planned in your goal. So leave it to the healthcare provider, the physiotherapist, so or the physician, let them decide what type of treatment you need. Because as which anatomical structure is affected, accordingly only the treatment will be planned. So coming to the treatment, there are some treatment what we can do from the physiotherapy side is improving your muscle strength, that is our core muscle strength and the postural exercises. So talking about these postural exercises, so you should know about what is good posture and what is bad posture, right? So the posture is the important role for maintaining, that means for the low back pain improvement, right? So talking about these exercises, improving the strength of the core muscles, the abdominal muscles and the back muscles. So this is one of the important treatment area by the physiotherapy perspective. So other than that, about your lifestyle, about your, that means the way how you are using the gadgets. So all these things also have to be considered in your mind. So to reduce the back pain. So how much improvement you will be getting from this back pain? So it's all depends upon how you focus on your daily activities. So active lifestyle is very important for improvement in this back pain. So what about the complication of this back pain? So most of the people will get improved by themselves or within a few days from this back pain. So 1 out of 2 people will experience the back pain repeatedly, and 1 out of 5 people will be having the back pain as a lifelong problem. So it's always better to say prevention is better than cure. So take care of your back. Thank you.